surgery. وهاي المحاضرة هو fluid in surgery. بقت لكم محاضرتين، هو الwound healing and wound infection، إن شاء الله يعطيكم إياها الأسبوع الجاي دكتور عبد الهادي. About fluid in surgery، محاضرة مهمة. We start by introduction about the fluid. Total body fluid account for approximately 60% of the total body weight. This can be divided or can be increased to the 70% or higher in a newborn, down to 50 to 50%, 55% in women. The women is less fluid in man. The total body fluid can be divided into intracellular and extracellular. From this body weight, اللي هو about total body water, about 60% of the body weight. From this total body water, 2/3 of this is intracellular fluid, and 1/3, about 33%, is extracellular fluid. Okay? ربع الاكستراسيلر فلويد is intravascular، اللي هو يصير بلازما وبلد تقريبا 5 لتر العفو. And 3/4 75% of this extracellular fluid is interstitial fluid. تمام؟ هذا الفيجر أهم يبين التقاسيم الفلويد in the body and it is percent. لو تلاحظون انه 2/3 of the total body fluid is intracellular and 1/3 is extracellular. Extracellular fluid account for 1/3 of the total body weight. And extracellular fluid divided to the interstitial fluid and third space fluid. هاي كمقدمة. نجي على type of IV fluid اللي يحتاجها surgical patient. There is 3 types of the fluid in surgery, either crystalloid، هسه أقول لكم شنو معناه، وcolloid and blood product اللي أخذتوها أنتم بالبلد ترانسفيوجن محاضرات الفصل الأول. crystalloid fluid شنو معناه؟ معناه fluid that contain a small molecule that flow easily through the cell membrane. This will increase the full fluid volume in both interstitial and intravascular space. هذا الفرق الجوهري بين الكريستالويد والكولويد. الكريستالويد يحتوي على small molecule that flow easily through the cell membrane. This will increase the fluid volume in both interstitial and intravascular. While in colloid solution contain large molecules that do not pass the cell membrane of the cell, they remain in the intravascular compartment and expand the intravascular volume by drawing fluid from the extravascular space. تمام؟ The crystalloid يتقسم إلى 3 أقسام. crystalloid fluid إلى isotonic، hypotonic and hypertonic. يعتمد على تراكيز السوليوت الموجودة بالفلويد. For example of the isotonic, the famous one هو normal saline اللي هو 0.9 صوديوم كلورايد، اسمه normal saline. تمام. lactate ringer solution, another example of isotonic. 5% dextrose water and ringer fluid or ringer solution. While the example of hypotonic اللي هو half saline اللي هو 0.9 بالعشرة 0.45 صوديوم كلورايد، والثلث السلاين اللي هو 0.33 صوديوم كلورايد و 0.2 صوديوم كلورايد and 2 and 5 dextrose water. This is hypotonic. وكل واحد إلى uses وكل واحد إلى precautions for uses of this fluid نجي عليهن واحدة واحدة. Example of hypertonic saline اللي هو 3% صوديوم كلورايد. زادت النسبة مال التراكيز الصوديوم والكلورايد صارت 3%، صار hypertonic. Okay. While 5% dextrose with the normal saline considered also hypertonic. تمام. نجي the first one اللي هو most famous one is normal saline. تمام. اللي هو 0.9 صوديوم كلورايد، يعني ماء وملح. Indication of uses of normal saline. First one, to treat volume deficit from hemorrhage, severe vomiting or diarrhea, or heavy drainage from the GIT sections, يعني drain وعندهم fistulae or wounds. This first indication. The second indication, shock state, hypovolemic shock state. The third one is mild hyponatremia. When there is mild hyponatremia, can be treated by normal saline. While severe hyponatremia need hypertonic saline، يعني بيها صوديوم هواي. For metabolic acidosis, diabetic ketoacidosis, the first choice of the fluid is normal saline. ما يعطونا another solution، ما يعطونا رينجر، ما يعطونا أكيد dextrose is contraindicated. While normal saline is the first choice in diabetic ketoacidosis. 5. Indication, resuscitation of the patient in casualty. أول ما يتبادر ذهن الطبيب إنه يعطي فلويد يعطي نورمال سلاين بالبداية. In shock state, in trauma. تمام. 6th indication, it is the only fluid used with the administration of the blood product. كل الفلويد البقية cannot be given with the administration of the blood product. These 6 indications for normal saline. What is the caution or precaution to give normal saline? Because normal saline replace the extracellular fluid, it should be used cautiously in certain patients. For example, those with the cardiac or renal disease. Those with the cardiac failure, renal failure, we give in precaution normal saline in large amount for fear of fluid volume overload. تمام. Another example, which is common, dextrose 5% solution. It is considered an isotonic solution مثل ما قلنا, but when dextrose is metabolized, the solution actually becomes hypotonic and causes fluid shift into cells. What is the caution for use of dextrose saline? Dextrose water العفو is not good for patients with the renal failure or cardiac problem. Why? Since it causes fluid overload, like normal saline. Patient at risk for intracranial pressure should not receive dextrose water since it causes cerebral edema. Patient with the intracranial pressure increase should be not use the distal glucose water because it may cause cerebral edema. It should not be used in isolation to treat fluid deficit. ما يستخدم بوحدة بالشوك ستيت بالتروما برستيشن because it dilute the plasma electrolyte concentrations. Never mix dextrose with the blood as it may cause blood to hemolyze. Not used for resuscitation مثل ما قلنا الساعة because the solution will not remain in the intravascular space. أحتاج normal saline. الهايبرتونيك saline يبقي الفلويد intravascular ولذلك أنا أريد blood pressure يبقى within normal فما أعطي ديكستروز على مود الفلويد يروح من الفيزلز لا أعطي normal saline أعطي هايبرتونيك saline حتى يسحب لي الفلويد يسحب لي الووتر ويبقى البلد بريشر قدر الإمكان محافظ على نفسه in shock state and resuscitation. Dextrose water not used in early post-operative period because the body reaction to the surgical stress may cause antidiuretic hormone to increase in antidiuretic hormone secretions. Okay. Another third famous fluid that used in surgery is ringer lactate, the other name Hartmann solution. It's the most physiological adaptable fluid because it is electrolyte content is most closely related to the composition to that contained in the blood and serum. So it is called physiological fluid. يعني الكونتنت مالته نفس الكونتنت مالته content in the serum or blood. Another choice for the first line fluid resuscitation other than normal saline is ringer lactate for certain patients such as those with the brain injury. It is preferable in patients with brain injury or head injury or العفو burn. تمام. What is the indication for Hartmann solution? First one, to replace GIT fluid loss. مثل ما قلت لكم يحتوي على الكترولايت like in the plasma احتاجه انا بالجي اي تي fluid loss. Regarding the fistula drainage, for example, fluid loss due to burn and trauma. بالburn it is preferable. Patient experienced acute blood loss or hypovolemia due to third space fluid shift. احنا عندنا example of third space fluid shift مثلا بالكرياتايتس يصيرون hypovolemia due to third space fluid shift. The preferable fluid is ringer lactate. What is the caution to use the ringer lactate or Hartmann solution? Do not give ringer lactate to patients with the liver disease. Any patient with the liver failure, avoid large amount of the ringer lactate as they cannot metabolize the lactate because have liver failure. Also, use the ringer lactate with caution in patients with severe renal impairment because it contains some potassium and should not be given to the patient with pH when it is greater than 7.5. When the pH is يعني alkalosis, in case of alkalosis, it is should not be given. تمام. Another example is ringer solution. نفس الرينجر لاكتيت لكنه ما بي لاكتيت. Used in similar fashion as lactated ringer, but does not have the contraindication that related to the lactate. يعني بالليفر فيلر كان بي given ringer لأنه ما بي لاكتيت. أوكي شباب. Hypotonic fluid. Hypotonic fluid have a lower concentration of the solute مثل ما قلنا, and the osmolarity of the hypotonic fluid less than 250 milliosmol per liter. It lowers the serum osmolarity within the vascular space, causing fluid to shift from the intravascular to both intracellular and interstitial space. Those solutions will hydrate cell, although their use may deplete fluid within the circular system. عادة ما نطي بالشوك، لأن مثل ما قلت لكم بالشوك أحتاج intravascular fluid. هذا لا، هو يروح الفلويد from the intravascular. شنو الانديكيشن of hypotonic fluid؟ The of hypotonic fluid is used to treat patients with condition causing intracellular dehydration, for example, hypernatremia and DKA, and hyperosmolar hyperglycemic state. Hyperosmolar hyperglycemic state is the third indication of hypotonic saline. شنو الكوشن of use of hypotonic saline? It should be never given in patient who has risk for increased intracranial pressure because it may exacerbate cerebral edema. يعني any patient with increased intracranial pressure should not be given because it may cause cerebral edema. Also, do not use hypotonic solution in patients with the liver disease, trauma, or burn because it is a potential for depletion of intravascular fluid. يعني هو يفاقم الشوك state of the patient with the trauma or burn. يطرد الفلويد من الفيزلز. Hypertonic solution استخداماتها محددة. شنو معناها؟ معناها solution that have a higher tonicity or solute concentration. They have osmolarity more than 375 milliosmol per liter or higher. The osmotic pressure gradient draw water out the intracellular space and increasing the extracellular fluid volume. So they have used as a fluid expander. هو هذا اللي يستخدمه بالشوك ستيت. Indication of hypertonic saline. Patient with the severe hyponatremia. إذا patient قلنا mild hyponatremia نعطيها normal saline يحتوي على كمية من الصوديوم اللي هو تقريبا 154 ملي equivalent per liter of sodium كافية to treat the hyponatremia إذا mild. But in severe hyponatremia can use hypertonic saline. Second indication of hypertonic saline, patient with cerebral edema. Any patient with the cerebral edema ما نعطيه hypotonic because it is contraindicated. نعطيه hypertonic saline. كل fluid will be caution. Be alert when giving hypertonic solution because of their potential for causing intravascular fluid volume overload and pulmonary edema. Sometimes the use of hypertonic saline in large amount may cause pulmonary edema and left side heart failure and exacerbate liver failure, heart failure. Should not be given for indefinite period of time. يعني قلت لكم الانديكيشن مالته بوقت محدد، ما تعطي بكميات كبيره و long period. colloid solution. هسه اخذنا الكريستالويد واخذنا قلنا 3 انواع، هو ايزوتونيك، هايبوتونيك، هايبرتونيك، واخذنا كل واحد وصفاته وكل واحد الانديكيشن مالته والكوشن مالته واليوزز of each one of the crystalloid. نجي على الكولويد. Colloid solution expand the intravascular volume by drawing fluid from the interstitial space into intravascular compartment through their higher oncotic pressure. The colloid solution contain higher oncotic pressure. كل مكان ب high oncotic pressure الفلويد راح يجي وياه. The same effect as hypertonic saline or crystalloid solution, يعني hypertonic saline, but it requires administration of less total volume and have longer duration of action because the molecule remain within the intravascular space longer. The most important colloid solution is albumin, 5% albumin. The most commonly utilized colloid solution is albumin. It contains plasma protein fraction obtained from human plasma and works to rapidly expand the plasma volume. What are the causes of albumin? Used for volume expansion in shock state. Also, moderate protein replacement. Achievement of hemodynamical stability in shock state. شنو contraindication of the albumin? Contraindication in severe anemia, in heart failure, in non-case of sensitivity to the albumin, and angiotensin converting enzyme inhibitor should be withheld while giving albumin for at least 42 hours before administration of the albumin because risk of atypical reaction between the albumin and angiotensin converting enzyme inhibitor such as flushing and hypotension, etc. Sign of transfusion reaction of the albumin like fever, flank pain, vital sign changes يعني يصير شوية hypotension, tachycardia, nausea, headache, urticaria, dyspnea, and bronchospasm. How you treat? Treat by stop transfusion of albumin and keep the IV line open with the normal saline. Notify the physician and blood bank and intervene for sign and symptom as appropriate or monitor the vital sign of the patient. Other colloid is hydroethyl starch. This is another form of the hypertonic synthetic colloid used for the volume expansion, contains sodium and chloride used for hemodynamic volume replacement following major surgery and to treat major pain. Less expensive than albumin and their effect can last for 1 to 3 hours days life. هاي مقارنة بسيطة بين الكريستالويد والكولويد مطلوبة من عندكم. advantage و disadvantage of each crystalloid مثل ما قلنا حاكينها كلها. fluid therapy in surgery used in pre-operative fluid therapy and post-operative and intra-operative period. في كل مرحلة من السيرجري نستخدم الفلويد. In pre-operative fluid therapy, the giving of maintenance fluid should be all that required in otherwise healthy individual who is under order of receiving nothing by mouth. يعني نعوضه إذا هو قل ما تاكل وتشرب for 2 days for example, or sometime before the time of surgery. This does not, however, include replacement of a pre-existing deficit or ongoing loss. Maintenance therapy calculation of the fluid حتى تعطي المينتنس ثيرابي اوف فلويد هو تحسب له حسب الكي جي. اعطيتكم اياها بالبوست اوبراتيف كير. اول 10 كيلوات من الوزن من وزن الشخص المريض نعطيه 100 مل بير كي جي بير داي. يعني اذا وزنه فرضا 15 كيلو اول 10 نعطيه 100 مل بير كي جي، والخمسه for the second 10 كي جي نعطيه 50 مل بير كي جي. يعني مثل ما قلت لكم 10 على 100 يصير 1000. إذا 15 الخمسة البقية نعطيهم على 50 فيصير 250 1250 إذا 15 كي جي، وهكذا تحسب. إذا فوق ال 20 كي جي for the weight above the 20 كي جي لا نعطي كل كي جي زايد نعطيه 20 مل. يعني فوق ال 20 ما نعطي 50 بير كي جي، لا نعطي 20 بير كي جي. فاحسب اول 10 100 ثاني 10 على 50 من 20 وفوق 20 مل بير كي جي. بالضبط نفس المعادله اللي اعطيتكم اياها بالمينتنس اوف فلويد ثيرابي. يفضل 5% ديكستروز مثل ما قلنا the appropriate volume or half saline as initial therapy with the potassium added for the patient with the normal renal function. This is maintenance therapy in patient with surgery. Fluid deficit in surgical patients. Many surgical patients have volume and or electrolyte abnormality associated with their surgical disease. It must be evaluated as vital step in the pre-operative assessment and care. Volume deficit should be considered in patients who have obvious GIT loss, such as through hyperemesis or diarrhea, as well as patients with the poor oral intake secondary to their disease. واحد عنده نروكسيا. Less obvious cases are those with the third space or non-functioning functional extracellular fluid loss that occur with the GIT obstruction or peritoneal or bowel inflammation, ascites, crush injury, pain, severe soft tissue infection such as necrotizing fasciitis. These conditions causing loss of the fluid through the third space. How to assess hydration status to the patient? Examination of the dehydration by patient level of consciousness. The patient have thirsty, eye glistening, sunken eye, floor of the mouth, tongue, skin turgor, examination of the pulse regarding rate, volume, blood pressure, and the last thing is urine output. These all to check to assessment of the hydration status of the patient. واضح شباب؟ لحد هنا محاضراتكم خلصت regarding the fluid in the surgery. إذا عندكم سؤال سئلوا. مثل ما قلت لكم هي المحاضرات الأواخر بالجراحة، بقت محاضرتين regarding the wound healing and wound infection يعطيكم إياها دكتور عبد الهادي إن شاء الله الأسبوع الجاي، وتخلص المحاضرات البرنسبل أوف سيرجري للصف الثالث. إذا عندكم سؤال سئلوا شباب.